Good evening, everyone. I'm Chris Ensing, host of CBC Windsor News, our digital show that we've been offering for the last little bit here, and we have the latest updates on what you need to know. Now, tonight's show, we're doing something a little different. What we're going to do in a few minutes is talk to a news director who normally works in Detroit to hear about what life is like there right now. I know a lot of people in our community have lives that are deeply connected to the community of Detroit and the surrounding area, so we're going to get an update on what they're looking at. The cases there are really just jumping, and we're seeing more and more community spread on that side. It's something our health unit talked about as well. If you have any questions for him, feel free to leave them in the comment section. We'll be sure to ask them. Locally here, we want to start with the latest update from Windsor-Essex County Health Unit. There are now officially 4 confirmed positive cases of COVID-19. Now, what we do know is that this 4th person that has been diagnosed with the coronavirus is another case of someone coming into our region from the United States, according to the Chief Medical Officer of Health. Now, he says that when it comes to community transmission, there's no proof of that happening right now through the testing that's been offered and that has been completed. That's when we start to see local contacts where they don't have international travel. But in the case of Windsor, the 4 cases in Windsor-Essex, they have been because of international travel. That doesn't mean that we're not expecting that to happen. Dr. Ahmed said that the risk to Windsor-Essex is increasing. Now, that 4th case is a man in his 60s who traveled in the U.S., returned to Canada on March 13th. He was seen at the local assessment center after developing symptoms. Now, with all of this being said, the health unit has called for tighter borders, and part of that comes with the idea of what we're able to control on our side, saying that the Ontario government has closed non-essential services versus what's happening over on the other side of the border in Michigan, where we continue to see that outbreak. Specifically, he said here that the border continues to be a concern for the residents of Windsor-Essex and for the health unit. We're concerned about the travel to and from work in Michigan for our residents of Windsor-Essex. He put out a call to say that he wanted more people to be considering options where they're able to work by being at home, telework, telecommuting for those that do have to go in Michigan because of the proof of community spread in Detroit specifically. Now, I did reach out to the public safety minister about this, and he said, or a person from their office said, quote, "As we take a whole of government approach to addressing COVID-19, we're constantly evaluating the situation, considering next steps. We will continue to work with health authorities, border officials, provincial and territorial counterparts, municipalities, and our international partners to do what's best for Canadians." This as Detroit area hospital system is almost at capacity. Another major update today for our viewers in Sarnia-Lambton. They had their first confirmed cases of COVID-19 today. 5 people, all of them in their 60s, have confirmed tests that show they're positive for COVID-19. Now, those 5 individuals showed up at the emergency department in Sarnia, and a spokesperson said that they were tested with results coming back within 24 hours. Now, you'll remember that it's taking up to 7 days for it here in our community. We asked a spokesperson why it happened so quick. They told us this was expedited because of the severity of the illness and the symptoms that we're showing. We do not have an update on their status as of now, but we do know that they are being treated in the hospital in Sarnia. You've heard all week about the call for better personal protection equipment or more options for the people on the front line. And we have a story about what some members of our community are doing to try and help out at this time. We're going to bring in Tamina Aziz now. Tamina, if I could just get you to put your hand out right here. We're doing physical distancing, so yes, there's a few of us who are still inside of the office, but while we're here, we're making sure that this is as close as we come to each other. Tamina, you've been doing a good job at finding some of the helpers during this pandemic. What's the latest story you have for us?
That's right, Chris. I spoke with a few Windsorites who are making masks at home. As we know, there is a global shortage of masks according to the World Health Organization. So I spoke with 2 women, Shelley Worley and Karen Harris. Now, for Worley, she's a frontline worker in long-term care. She saw a post online about children with compromised immune systems who needed masks. So she brought it upon herself to make some at home with the help of her sister, and so far she's donated about 270. He says it's unclear as to how effective masks in general are, but especially those made from cloth, which is what they made their homemade masks with. He says people don't tend to handle masks well. They don't handle it properly. They touch it too much. They play around with it, which basically negates the whole purpose of wearing one to begin with. He says the best strategy to stay safe and to protect oneself is to practice social distancing, which is what we're doing here today, of course. Regardless of how effective masks are, however, these women say they'll continue making them. They ask for members of the community to help them out. They say, you know, a little protection is better than no protection at all. Chris.
Thanks, Davina. Another look at what some people are doing in our community during all of this. I appreciate your work on this. Again, as we talk about the need for masks and the need for people to help each other, I was able to speak with the person who is responsible for 5 different hotels in southwestern Ontario. His name, Rakam Sharam. Now, what he told me is how he's trying to help people on the front lines. He owns or operates the Holiday Inn on Huron Church, just at the Ambassador Bridge. As you can imagine, business there has been a little slow compared to what it usually is. He said for a while there they were getting snowbirds who were coming back from the United States who were stopping off before going to their next location. He said that staff has been kept as safe as possible during all of this. They're following all of the ministry guidelines. But one of the things that's happened now is he's had to have a massive layoff. There's usually about 300 or more people who work for him at these 5 different hotels, 1 in Windsor, 3 in London, 1 in Cambridge. Because of the layoffs and because of the empty rooms, he finds himself in a unique position to help out. So what he's done is contacted the Ministry of Health and offered any help that he can for people who are on the front lines. Specifically, he said he's able to offer entire floors of rooms to healthcare workers who might need to self-isolate after coming in contact with someone who has COVID-19. You can imagine some people in our emergency rooms, some people who work at Windsor Regional Hospital, if it gets to a point where they have to self-isolate from their family, going through such a difficult time at work, incredibly busy from all we've heard, to then have to go home into separate rooms and not contact the people that you love. So this offer is for them to be able to go to a place where they can not have to worry about putting that added stress on their family at home. One of the first calls that they got from the Ministry of Health was from a paramedic group that asked if they could have an entire floor of rooms that were exclusive to them so they could make sure they kept their employees safe. Now, as far as that Holiday Inn location, the staff that are there, they're not going to offer the same cleaning supplies or services because of how busy and how difficult that would be to put on the employees that have remained employed during this time. And so what he says is they're going to do what they can under the Ministry of Health and making sure that they're providing something that's safe and making sure that they're following all the guidelines so their employees are safe too. And that's just one of the stories here that we've been working on as we look at ways that people have been able to help each other during a time of a pandemic for us here in Windsor, Essex. I'm going to come over here now. Again, as we mentioned before, things a little bit different here. I'm just going to pop over to where we have appearing now via Skype. We have Jerome Vaughn. Jerome, I'm just going to get you set up here. And as we get you set up here, if we could, you are with WDET in Michigan. What's life like for you right now across the border? We find you at home.
That's right. It's pretty crazy here. A lot is going on. The death toll from the coronavirus has risen dramatically in just the last couple of days here in Detroit. Throughout the state, we're up to almost 2,300 cases, and that includes 43 people who have died. We've had 500 new cases just really overnight, and the testing continues. Part of the problem is the testing, there's not enough testing going on. So there are a lot of people who have it or probably have it who don't know. And so that's part of the problem with where we are right now.
When we look at what's happening in Detroit and you rattle off those numbers, those for us seem a world away, because here in Windsor we've been at a point where we only have those 4 confirmed cases, but Detroit is so close to us. Like all of us, have lived a life really where we've been able to access your community and be members, proud members, and supporting of the restaurants, the bars, the concert venues, the shops. How are people feeling during all of this?
I think the word that really comes to me is shocked. So it was just over 2 weeks ago, March 10th, when we had our first couple of confirmed cases in the state. And so things have really just ramped up since then in a way that, you know, doctors and people who are watching the disease elsewhere have predicted. But the average person here just is really stunned by how quickly this has ramped up. I think really in the past couple of days, it has really hit home in the sense there have been some deaths of people who are known in the community. One is a big civic booster, someone who's been working in the city for a long time. He was mid-40s. There were a couple of people who have died on the Detroit police force. Both were in good health. One was 38, the other was just 50. And so people here are starting to get an understanding of how bad this can be without it being, you know, just people who are over the age of 65. And so they're learning to cope with that. Things have cleared out. The governor has issued a stay-at-home order except for crucial employees. That's, you know, that has done things like keep people off the roads. Fewer people are going to the office to go to work. And, of course, bars and restaurants have mostly closed except, you know, for carry-out orders. So that has also hopefully made a difference, but we won't know for a little while.
We've heard on our side of the border about, and we talk about this a lot, the importance of that essential services crossing over into Detroit, specifically talking about the people who work in healthcare here in Windsor, Essex, that are going to the hospitals. Can you give us a sense of what it's like at the hospitals in the Detroit area?
Quite hectic. We've gotten word that Henry Ford Hospital, which is a major system here in Detroit, they have 2 of their hospitals are nearing capacity for coronavirus cases. Beaumont Hospital, another system in Metro Detroit, is getting close to capacity for its coronavirus cases. And in both cases, they're looking for where else can they put coronavirus cases if need be. Wow. Maybe that is university dormitories. Maybe that is, you know, other public buildings. There are problems with that, but they're really worried about running out of space inside the hospitals. I think the other issue that goes with that is people who are sick or have injuries that have nothing to do with coronavirus. Those injuries, those other ailments don't dissipate during this crisis. And so Henry Ford is moving some patients out of the main hospital to other places when they can, so there's no risk of other patients being infected. So there's a lot going on in the healthcare industry right now in Detroit.
We also rely on the auto industry here, and I know that's a big thing for you guys as well. What have we noticed, or what have you noticed that strikes you when you look at what the big 3 have done and what they're able to do next?
Well, I think early on in this crisis, and early on would be a couple of weeks ago, things were continuing as normal. I think the automakers were looking at contingency plans, but pretty quickly as things ramped up, the United Auto Workers Union started hearing from its members that they were concerned that there wasn't enough cleaning going on in the plants. There was concern about workers getting sick from working so close to one another. So the automakers have decided to, you know, limit or shut down production for a short period of time to, you know, clean plants, make sure their workers are safe. But unfortunately, it hasn't been quick enough. A couple of workers at Fiat Chrysler have died from coronavirus in the past couple of days, and that's not necessarily because they worked at a plant. Everyone who has been out and about is at risk.
As we hear about how much this is affecting the community, the city, I'm looking at here, I see what I think is a family photo behind you there. How are you doing? How are you holding up?
Yeah, that's my son back there when he was 3 years old. He's 26 now. But it's been a challenge. I've got 4 kids still at home. they are doing fine. It's like another week of spring break for them, basically. But I'm concerned as a parent. I'm worried about going out and getting groceries. I'm an essential employee, so there are days when I go into the office and I'm want to make sure that I am protecting myself and protecting them when I come home. So it's something that's constantly in the back of my mind. But I think, like many of us, we find a way to move forward and keep going.
As we think of the people that your community has already lost to this virus, the police officers, the city champions, the line workers, what do you look at as the bright spots? Have there been moments or stories that stand out for you as an example of Detroit rallying together, having that spirit that we know it's known for?
I think a few things. I know that I saw a story a couple days ago about teachers in a Detroit suburb got in their cars and drove through the neighborhood where their kids, their students live, honked their horns, waved at them. Wow. The teachers wanted to let them know that they still cared for the kids and they missed them very much. I'll just say, this afternoon I went outside because the sun is out and, it's in the 50s for the first time here in a long while. And just seeing people walking by and having a chat with some strangers and asking if they're all right and, sharing words of encouragement. So I think those are the bright spots that come to mind for me.
Thanks for taking the time to highlight that. Just before we let you go here, I do appreciate you taking the time to speak with us, but with your perspective that you've gained, having lived through some of these difficult times already, what's some of the advice you might have for a community like ours, where we're not seeing that surge at hospitals yet?
I'd say prepare for it. Take care of yourself, wash your hands, cover your coughs, practice social distancing. Don't think this is a joke. Don't think this is something that's not going to affect you. Just really prepare for it. Get your house in order. Be ready to spend some time there if you need to do that.
Okay. Thank you again for your time, Jerome. I really appreciate you chatting with us, and I hope you and your family are safe, and good luck with continuing to operate a newsroom from difficult times.
Thanks, Chris. You stay safe, too.
Thanks. Appreciate it. I'm going to hang up on you here. Nothing personal. Ooh. It strikes you just hearing about how a community that is right across the river, we can see it here in our studio. I pass by it every single day to come into this office, and to hear how they're being affected. Hundreds and hundreds of cases, 700 cases in the Detroit area of COVID-19 and positive tests, listening to the people that they've already lost. And that call there just at the end for us to treat this seriously, that it's not a joke, and that this is something that one day will likely come to our community. When we hear about the morning briefings, when we talk to Dr. Ahmed, and he says that the risk in Windsor, Essex is increasing, and it's just a matter of time before we start to see a community case. I know that we only have those 4 cases that are positive here in our community now, but it's an example, I think, of how quickly this spreads. And I appreciate you watching tonight. We'll continue to have updates on these stories on our website, cbc.ca/Windsor. Our Windsor morning team is bringing you content and the stuff you need to know every single morning. They're talking to the ER doctors, they're talking to the mayor, they're talking to the people who are making the decisions that will impact you and your family and the community at large. We'll also have those updates on our social media feeds as well. You can find us on Facebook and Twitter as well as Instagram. Just search CBC Windsor on any of those. Thank you for watching. Stay safe.